that diet and exercise can change a lot about whatever medical condition you're facing. Knowing it and motivating yourself to do it can be very different. More than 8 million Californians are living with at least one of the most common forms of cardiovascular disease, nearly 1 in 3 adults. But today, one Kaiser Permanente patient who's faced all of that and the doctor who's guided him through it are with me now live in studio to explain how you can do it too. Pete Rabone and Dr. Brandley Nagel, thank you so much for joining us today. Now, Pete, you were a cardiac patient. Tell us what was going on with you and how you realized that you were in trouble.
Okay, I was a regular bicycle rider. I mean, 30, 40 miles per ride.
Oh yeah, if that's regular.
And one day when I rode to the start, which was only 4 miles away, I could barely make it. And I thought something was wrong. Barely rode back home and went to Kaiser after that, and sure enough, they said I have heart disease.
And what was the prognosis?
They put a stent in a little bit later.
Okay.
And then got back on my bike and was able to do things as I had always been.
Well, that is great news. Now, as part of your effort to battle all of this, you've changed your diet quite a bit, right? And recently just took a lifestyle medicine cooking class.
Correct.
And so tell me about that.
Okay, I actually didn't, well, I changed my diet for a short period after the stent. And then a couple years later, after I fell off the wagon, I got onto the program that Kaiser has for lifestyle change. And that's where I got serious on changing my diet.
Okay.
And 6 months later, after changing my diet, I'm no longer on blood pressure medication. My cholesterol has been cut in half. I can crawl around on the ground with my 5-year-old grandson.
Oh, which is really important. That's the win right there.
I lost 50 pounds in that process. And when I ride my bike now, I have a heart rate monitor. My heart rate's about 10 beats less per minute doing the same kind of riding. So just from the diet change, it's been phenomenal.
Wow, well, that is such good news. And Dr. Nagel, you're the clinical lead for Kaiser's Lifestyle Medicine program. So this is National Nutrition Month. Change in diet is also part of HALT, the Health Achieved Through Lifestyle Transformation. And in this case, we're talking about a whole food, plant-based sort of thing. And he says he finally was able to get serious. So this must be something that you're presenting that people can actually stick to, because we've all tried some kind of diet and it's just not sustainable. So what's different about what you're doing?
Absolutely. Happy to discuss that. Thank you for having us. Good morning. We emphasize 6 pillars of lifestyle medicine in our programs. And one is definitely the whole food plant-based nutrition. And we meet the patients where they are. Okay. And we also assess them for what their goals are.
Even if it's McDonald's.
If that's their starting point, exactly.
Okay.
So yeah, the other 6 pillars include the exercise or physical activity, which, as he described, he was already doing very well in that department. We also talk about the importance of sleep, restorative sleep, healthy social relationships, avoiding risky or toxic substances, and healthy forms of stress management. Okay. So we address all of that throughout the program.
I'm just going to stop you at restorative sleep, because everybody says, okay, well, I go to bed, I sleep. What's the difference between going to bed and restorative sleep?
You want to feel refreshed in the morning when you're waking up. Though sleep needs to be quality sleep. You want to minimize the amount of broken sleep that you're having, and try not to be one of those warriors bragging about how little sleep you're getting. The sleep really is valuable to your health.
Okay, so Dr. Nagel, what do you see out of most patients who enter HALT? What is the outcome? Is it all like Pete here?
It's a collaborative effort. You know, we have a huge team on our side. We have experts, in addition to the physicians, we have pharmacists, behavioral health experts, our educators, and, group facilitators and coaches. But it's also the patient, right? They have to be contributing as well, and they have to be motivated to start a program like this and really be ready for change.
It has to be a program that, is suggesting or cultivating or motivating buy-in. Now, people know that you pay to belong to Kaiser. That's part, it's not only a hospital, it's an insurance here in California. Yes. Is this a cost above and beyond that to be in this program, or does this come with what you already may pay to your employer for insurance?
No, we are very proud to be able to offer this with minimal additional cost. Occasionally, maybe a lab draw might have a copay
Okay.
with it, but no, there's no additional cost for this program specifically.
We've had this big inflationary cycle, so people are very concerned
Yes.
about, they want to do something for their health, do something different. They're very concerned about the additional cost they may be getting roped into. And before we run out of time, Pete, what do you want to say? There's somebody who is getting a diagnosis like what you got today, and they are feeling like, I can't really change this, I can't really do anything. What do you want to say to them?
You can change it. You can really do something. And what's good about the Kaiser programs is it is really a team effort. And that's what really got me over the hump, was it's a team effort working together.
Alrighty, thank you too for coming in studio today. Congratulations to
Thank you.
what you've been able to accomplish, and we're going to let you go so you can, spend some more time on the floor with your grandson.
Yes.
Okay. Alrighty, thank you very much.